Head to the big city anymore for issues with your hand, wrist, or elbow. In this week's edition of the Health Beat, we're going to talk about the Philadelphia Hand Center and their new office that is in correlation with Commonwealth Health. Dr. Rick Tosti from the Philadelphia Hand Center is here now. Doctor, thanks for being with us.
Thanks for having me.
So I understand the Philadelphia Hand Center has a new local office. You've partnered up with Commonwealth Health. Tell us what's going on.
That's correct. We are the Philadelphia Hand Center. We treat all conditions of the hand, wrist, and elbow. The group was founded about 40 years ago by two very famous orthopedic surgeons and a hand therapist in order to give comprehensive care to the entire upper limb. So patients come into the office, they can get a diagnosis, they can get x-rays, bracing, therapy, rehab, all in one place. Today the group has expanded to 17 surgeons, all of which have specialized training in hand and microvascular surgery, and all of which participate in national and international teaching and research.
So the Philadelphia Hand Center, a specialized service and institution that is here locally now. And Doctor, can you get into a little more about some of the things you treat when it comes to the hand, wrist, and elbow?
Sure. So most common things break down into bone, muscle, joint, or nerve. So bone problems break into fractures, which can be treated in casts or with surgery when they're more severe. Muscle problems usually manifest as tendinitis, various tendinitis around the elbow, like tennis elbow, maybe you've heard. Golfer's elbow, various tendinitis around the wrist, and trigger fingers are very common as well. The most common joint problems are arthritis. There's various types of arthritis in the small finger joints around the hand, thumb, and wrist, and larger ones around the elbow as well. And then the last thing I think we specialize in very well are nerve problems. Most common are things like carpal tunnel syndrome, cubital tunnel syndrome, nerves that are compressed, or nerves that are lacerated in trauma. We are also trained to treat those as well.
Doctor, in some severe cases, amputation sometimes is something that has to be discussed. Tell us what you do in that area.
That's correct. So in the upcoming months, I will be giving my sort of tips to prevent seeing the hand doctor. And in the winter, in particular, folks push their snowblowers in order to get the snow off the driveway. And over 1,000 amputations per year in the U.S. are caused by snowblower injuries. So a couple tips to avoid those are, one, using the snowblower on colder days, because when the temperature is above 28 degrees, or if the snow is a little more wet, it tends to clog. The other thing is, what people don't know is there's an auger that takes the snow off the driveway, but then there's an impeller that shoots it out to the side. And those gears within that compartment can also cause amputations as well. Most commonly, the snow gets clogged in that compartment, and people go to reach their hand in to unclog the snow and lose fingers that way.
All right, so things you certainly want to pay attention to in the colder months and colder season. Now, for those that want to find out more about the Philadelphia Hand Center locally, where is your office, and how can people reach you there?
Sure, so perfectly. So people do not have to come to Philadelphia anymore to receive treatment at the Philadelphia Hand Center. Dr. Randall Culp and myself have recently established an office on River Street, and we perform surgeries at Wilkes-Barre General Hospital. For more information, we have a website. It's www.handcenters.com. The number to make appointments is also quite easy to remember. It's 1-800-971-HAND.
All right, in this week's edition of the Health Beat, we're talking about the new relationship with the Philadelphia Hand Center and Commonwealth Health. Dr. Rick Tosti, thank you so much for being here today.
Great, thanks a lot.
Lots